So today we're going to talk about the cervical spine. And it's our last link in our spinal series here. And what's amazing about the cervical spine is its ability to be driven from multiple directions. In other words, when I look at motion from the thoracic and the lumbar spine, oftentimes ground reaction forces will drive the pelvis, create motion through the lumbar spine. The thoracic spine responds to the motion and the forces through the lumbar spine. And they'll create motion at the cervical spine. Best example of that is as we're walking and I take a step forward with my right foot and my left hand comes forward, which creates right rotation of my thoracic spine. The resulting motion is left rotation of my cervical spine. When motion is driven from the top down, that's as simple as looking over your left shoulder while you're driving to make sure there's not somebody in the lane that you're attempting to move into. So we have motion that can be driven from multiple directions, which is great because the cervical spine structurally, mechanically, and anatomically is set up to allow that motion to occur and to accept that motion and to allow the forces to be transmitted through the multiple segments that are created through the lumbar, thoracic, and cervical spine. So let's take a look at the cervical spine and see how that works. Anatomically, the cervical spine can be divided into the upper cervical and lower cervical. And the lower cervical vertebrae are fairly consistent, have some unique characteristics, but are significantly different than C1 and C2. And we'll visit those individually here in a minute. But a couple of things that make the cervical spine unique, anatomically at least, is the spinous process. If I roll that around, I look at the spinous process, and we can see that the spinous processes are what we call bifid in nature. So they have 2 points on the ends of the spinous processes. Now the other thing that's fairly unique, I can look at the large thoracic, I can look at the large transverse processes on the thoracic vertebrae, but when I come up and look at the transverse processes on the cervical vertebrae, they're much smaller, almost like a small nub. So they are significantly smaller, and there is an opening through the transverse processes, which is called the transverse foramen, and moving through that foramen is the vertebral artery, and the vertebral artery is the primary blood supply to the base of the brain. When I look at the facet joints in the cervical vertebrae from C3 down to C7, we can see that they're stacked almost like pillars, and that's oftentimes exactly what they're called. We will relate to them as articular pillars, and we can palpate those articular pillars all the way through the cervical vertebrae. Now when I look at the orientation of the facet joints, I can see that the facet joints are oriented slightly forward in that plane, but they are really set up nicely for rotation and side bend as they slide on each other. So I have taken an orientation from starting at the lumbar spine and moved almost 90 degrees to the cervical spine. Let's take a closer look at one of the cervical vertebrae and relate it back to some of the common characteristics that it shares with the thoracic spine and the lumbar spine. So if I extract out this C5 vertebrae, I can take a look at those characteristics that are common and those that make the cervical spine unique. And again, we already talked a little bit about the spinous process and the bifid nature of the spinous process. The posterior arch coming all the way around. So again, we've got the lamina, the articular process, that would be the superior articular process. Underneath would be the inferior articular process, and this gives us that good view of the angulation relative to the vertical. I have a posterior tubercle on the transverse process, an anterior tubercle on the transverse process. The body of the vertebrae, and we can look and see that it is fairly concave on the superior aspect. So something that is somewhat different relative to the lumbar vertebrae is that concavity on the superior aspect and a convexity on the inferior aspect. And again, one of the things that does make the cervical vertebrae unique is the transverse foramen for the vertebral artery. So that's kind of what a normal looking cervical vertebrae appears. And when I look at the orientation of these facet joints, so here's the superior and the inferior facet joints, and I can see that they run fairly, they're fairly straight in the articular pillars. When I have motion that occurs in the cervical spine, then the action of the superior facet on the inferior facet is really a gliding type of motion. So if I rotate my head to the left, the motion that I'll have on the facet joints is, if I spin this around, so if I rotate my head to the left, the superior facet will drop, and the superior facet will drop on the ipsilateral side and will elevate on the contralateral side. And what that does, because again, looking at this orientation, as I rotate away, and this is driven down, I will get rotation to the same side. So normal facet mechanics in the cervical spine are a little bit different than they are in the lumbar spine. So I will have my combined motions in the cervical spine being rotation and side bending to the same side, to the ipsilateral side. So that's kind of what we look at in the mechanical components of the lower cervical vertebrae. So when I look at left rotation, for example, and my vertebrae is moving that direction to the left, the way I can palpate it is by palpating the spinous process. So that spinous process is actually going to move to the right. So when we're feeling for somebody's cervical vertebrae and we're looking at the motion that is occurring, then I'll see that the cervical spinous process will be moving in the opposite direction. So it'll be moving to the right if I'm rotating to the left. I will have corresponding rotation to the left and slight side bending or lateral flexion as well. Okay, but that doesn't necessarily happen in the C1 and C2 areas. So let's take a look at what the atlas and the axis want to do with motions, and kind of how they're different anatomically. So what makes the axis and the atlas so different and functionally so different? And it really provides the link between the range of motion for our head, where our head, our occipital atlano joint, doesn't have much rotational motion at all, and that's a function of the facet orientation. But when I look at the atlas C1, I can see that it's just a ring-shaped, has a ring-shaped orientation to it. The superior facet joints are primarily concave. So the convex orientation of the facet joints from the occiput fit on the concave surface of the atlas. The other thing that you'll notice is significantly missing is a body. So there is no body associated with the atlas, and we'll see why that in a second when we put the two of them together. The other component is that the transverse process of the atlas is actually a little bit bigger than the other vertebrae, and we can actually palpate the transverse process just posterior to the mandible. Okay, so where does the axis fit in relation to the axis? And we can pull that up and we can see that the dens of the axis is really what comes up and articulates with the anterior arch of the atlas. So when I look at where the body would be for C1, the dens is really takes that space. And when I look at the ligaments, which we'll do here in a second, what holds the dens against the axis is what allows a significant amount of rotation to occur. So most of the rotation segmentally occurs between C1 and C2, and then we get incremental rotation from C2 down to about T3, T2, T3 when I have cervical rotation or head turning. When I turn my head, I'll have the majority of the motion occurring at this level, and then incrementally all the way down into the upper thoracic. Okay, now another consideration, another component that we can look at is a complete lack of a spinous process. So I can look and see that the spinous process is really just the posterior tubercle, and it's a spot for muscle attachment, as well as the posterior arches. So when I look at anteriorly along the anterior arch, there is a facet, which is what articulates with the dens. So the two of them together allow primarily for rotation to occur inferiorly, and then superiorly with the occiput. So now I can look at the occiput here with its convex surfaces. I get a little bit of nodding, really not much rotation. So I'll get a little bit of sagittal plane motion, not much transverse plane motion. and a little bit of frontal plane motion, so a little bit of side bend, occipital side bending. There's not a lot of motion that occurs though. So if I have tightness in this superior joint, at the OA joint, the tendency will then become to have excess motion further downstream. And so I start to see, especially with postural changes, I will start to see that kind of that forward head position and then a occipital extension, and then I'll kind of get stuck in that position. So people who have that forward head, instead of looking at the ground, they'll want to keep their eyes up because their eyes always want to be level. That will create a motion loss of flexion at this joint. And that creates, with a motion loss at that joint, that creates an extended position and excessive flexion through the cervical spine. So what keeps your head from falling off? Well, that would be partially. So what keeps your head from falling off? Well, besides the muscles and fascia and skin, the ligaments do. And so let's take a look at the ligaments that provide stability and support through the cervical spine, and some of which continue all the way down. We remember from the thoracic spine and from the lumbar spine the supraspinous ligament running right along the top of the spinous processes. Well, as I get into the cervical spine, it continues up and attaches into the occiput, and it gets nice and thick, and that becomes what we like to call the nuchal ligament. So the extension of the supraspinous ligament is the nuchal ligament, or the ligamentum nuchae is the other way that we can you'll hear it called. Zoom that in a little bit. Then I have laterally the inner transverse cervical ligaments, as I start to move deep to the vertebrae and bordering the posterior aspect of the spinal canal, is the ligamentum flava in the cervical region, again going from level to level, same ligament that we saw in the thoracic spine and the lumbar spine. A little more superior though is the posterior atlantoaxial ligament. And these ligaments are responsible for checking excessive flexion, as is the posterior atlanto-occipital membrane. As I move around, I have an anterior longitudinal ligament that runs all the way up to and includes the anterior and atlantoaxial ligament. But as I start to remove some of these layers, we'll see that I've got some pretty significant ligaments that are deep. So this is a good picture, a good illustration of the posterior atlanto-occipital membrane and the posterior atlantoaxial ligament. So I take these away, and now I can start to see on the inside the tectoral membrane of the atlantoaxial joint. The tectoral membrane is contiguous with the posterior longitudinal ligament. So we can see that posterior longitudinal ligament running the length of the spine along the posterior surface of the bodies of the vertebrae, and the tectoral membrane as that upper extension. So if I remove the atlas and remove the tectoral membrane, now I have direct visualization. I'm going to zoom in on this a little bit, of the cruciform ligament. And the cruciform ligament is the ligament that provides support to the dens against the atlas. So there is the transverse portion, there is the longitudinal portion, and then I have part of the tectoral membrane, and sometimes as well as the alar ligament. So the alar ligament attaches the dens to the occiput. This is the atlanto-occipital capsule, so the joint capsule that would surround that joint, with the longitudinal fibers, the transverse fibers of the AA joint, or the atlantoaxial joint, that articulation between the dens and the atlas. So those are the primary supporting ligaments for the cervical spine. And as we look at, in the next module, we'll look at the muscles that provide the mobility of and the dynamic stability through the cervical spine.